Well, today with us we have Dr. Jitendra Chauhan, and he's practicing in Jodhpur, Rajasthan. We're going to be talking about kidney stone management as of now. The very first question which comes to my mind when I think about kidney stone is, of course, asking for a doctor. That why the rise in a constant rise in the cases of kidney stones are at its peak these days? What could be the reason behind it?
No, we cannot say it is a peak.
It's not peak. We are yet to reach.
No, because the temperature, like you
but
know,
it's on a constant rise.
And like us, we are belonging to Western Rajasthan. That is more and more of dry area.
Yes.
So most of the cases means I can say it is more than 90% as we are dealing with the stone belt. So I think it will keep on going.
Keep on going.
Unless the lifestyle won't change.
What are the causes of that?
The one and most thing is like dehydration. The intake lifestyle that is not proper. The habit of drinking more and more water, or drinking not only water, the liquid, fruits, it's not there.
Well, what are the complications a patient might have to suffer with if he is delaying the process of getting a consultation with a urologist or a specialist?
So it is like we can differentiate, or like we can categorize it according to age. Most of the young patient came with the stone disease pain.
Okay.
Most of the older age, more than 50-60 years, they are coming with lower urinary tract symptoms because of prostate. So this is like we can differentiate according to the age. Other than this, if we deal with gender, most of the female, any age, they will come with the burning micturition, means recurrent UTI.
Well, any of the cases which you can recall wherein the patient was very late when it comes to the diagnosis, and you had a very critical case, but you dealt it, and how did you remove the patient's stone? How did you?
No, it is like, it is not rare case. It is too often.
Very often.
And
I'm asking about the most challenging case you have ever.
So these are all challenging case because what in Delhi we are sitting. In Jodhpur, most of the patient, like challenging patient, they are like gone kidney. That is because of stone disease.
Oh.
So like it is every day we are dealing with these cases. They are going to the renal failure because of only stone disease that is totally curable.
Well, what are the precautions a patient can take in order to avoid the stones and of course the recurrent stones?
The thing is awareness. Awareness and lifestyle changes.
What lifestyle changes we need?
Lifestyle change, that is that frequently going through the this lifestyle change means drinking habits, food, like avoidance of the foods, like what we can say, like the foods carries more oxalates, more purines. Like we cannot say that most of the people are non-vegetarian, so that that area is because of like what we are dealing in the south. Non-vegetarian are more and not dehydrated, but because of that cultural habit, the stone formation because of purines, and that is more. But in our cases, it is because of calcium oxalate stone most, and that one of the reason is dehydration. Other thing is like more oxalate fluid, like tomato, cashew nuts, and lack of habit of drinking water and fruits.
Well, when I'm talking about you, would you tell us that what is going to be the major breakthrough when it comes to the kidney stone domain? A breakthrough.
Breakthrough is, of course, medication.
Medication.
Of course, medication in like initial stage.
Okay. So, till what extent a medication might help a patient?
No, it is like more than 50%.
50% cases can be resolved by medication. Only if they are reported early.
Correct.
Yeah, that's the case actually. Well, when I ask you, because we have a doctor today, I would like to know what is your go-to kidney stone management solution to your patients.
No, it is like based on the at what stage patient came to us. Like if it is small size stone in the kidney, definitely we'll give medicine. Okay. If it is like stone size about 6, 7, 8 mm in the ureter, so still we will keep on giving medication until unless they are not producing any type of complication, like swelling in the kidney or increase in the like renal functions and intolerable pain or hematuria.
Well, I wanted to know, as we were talking about recurrent stones, So because the recurrency is a very high risk, I mean 50% altogether. So what a patient can do in order to avoid the recurrency of the stone, what he or she can do? Maybe a regular follow-up?
No, not only follow-up. Follow-up will only diagnose. It won't prevent.
Yes, yes. And apart from that, what?
So that same, that lifestyle changes.
He has to make sure that he is following all the lifestyle changes.
Correct. And even though that what we are saying that it is 50%, if they will follow strict lifestyle changes, water habits and that all, even though 20% still remain in the recurrent because of that genetic and food habits.
That's a very persistent problem actually.
Correct.
Well, thank you so much, sir, for your graceful time. We are very glad to have you with us. Thank you so much. Thank you so much.